surgical gloves to prevent cross-contamination, plaster and gauze and scissors to cover the wound or lesion after the skin assessment is done, ruler to measure the size of the skin lesion, moles, etc., pen and notebook to gather the subjective and objective data during the interview, and alcohol for hand washing to deter the spread of bacteria and prevent contamination. We must first perform proper hand washing to deter the spread of microorganisms and to prevent transferring bacteria from one place to another.
Good day, I'm your student nurse for today. My name is Isaiah Michael J. Velasquez. May I verify that this is indeed Mr. Ezekiel Enoch?
Yes.
Okay. So this is to know if you have the right client or if we're meeting with the right client. So, Mr. Enoch, during our assessment, what should I call you?
Mr. Zeke.
Okay, Mr. Zeke. So, this is to establish rapport and at the same time make the client comfortable. So, Mr. Zeke, the purpose of our skin assessment for today is to identify what your concern or problem is and what can we do about it. I would also like to inform you that I will be taking notes during our assessment to gather information and obtain data. And the questions would be asked will only be relevant to you and your concerns. Are we clear on that?
Yes.
Okay, so this is to know what and how can we address the client's problems. Okay, so Mr. Zeke, what language do you prefer to speak?
Bisaya.
Okay. Do you have any troubles or problems understanding English?
No.
Okay. Is it okay if I would be speaking in English?
Yes.
Okay, thank you so much. So this is to avoid any potential barriers that can hinder the assessment. So Mr. Zeke, do you have any questions, clarifications, or concerns that you would like to ask?
None.
Okay, so this is to know that the client is fully informed and know what's going to happen during the assessment and to avoid any misunderstandings. Okay, now let's start the questions. Okay, Mr. Zeke, please state your full name,
I'm Ezekiel Brent Enoch.
age please,
19.
address,
Davao City.
and phone number please.
09123445.
So this is to have information about the client and contact information in case if needed or in case of emergency. Now, Mr. Zeke, what is the reason for you to seek care today?
Last week mong good is nakoy nakaon siguro. Yan nag-start og katul akong liod hangtod sa everyday sige siya katul. Sipon ako ginakatul pud hangtod nagsamad-samad siya.
Oh, okay. So now, so I asked this so that I can identify what your concern is. Now let's move on to your history of present illness. So this is to know that how it started, when it started, how severe it is, and etc. Okay? So
Sige.
when did you start to notice the rash?
Last week Friday.
Okay. So have you noticed the rash? When you noticed the rash, did you immediately put any ointment or medications?
No, I just wash it with water.
Okay. So what do you think caused the rashes?
I think it's the seafoods that I
Okay.
ate.
Okay, what kind of seafood?
Shrimp.
Okay. So, did you see any major changes or changes around your skin color
No.
in different areas in your body? No. Okay. That's good. So, now let's go to your past health history. So, this is to know if the client had any past health problems. Okay. So, did you had any surgeries?
No.
Any major injuries?
No.
Okay. Aside from seafood, it was shrimp, right?
Yes.
Okay, so aside from shrimp, do you have any other allergies that you're aware of?
I don't think so.
Okay. How about, did you take any medications?
No.
Okay. Now let's move on to your gynecologic and obstetric history. So this is to avoid any complications or can cause harm to the patient or client. So, Mr. Zeke, are you currently sexually active?
No.
Okay. Now, let's go to your psychosocial history. So, this is to know if the client is under stress or if anything is going on aside when he's outside the hospital environment. Okay, so, are you, let me ask, this is a sensitive topic, okay? So, but let me ask you this. Are you experiencing any mental health problems?
I just have an anxiety.
Okay. Are things good at home with your friends?
Yes.
Outside? Okay. Okay, now, please can you describe me your lifestyle? So this is to know if the client is living unhealthy or a healthy life.
Well, I just started to perform some exercise in the house.
Okay. So why did you start exercising?
Last Sunday.
Okay. Okay, now may I ask if you can go sit down? Okay, since I'm done getting the answers that I've needed, the questions that I've needed, now I'm going to do your skin assessment, alright?
Okay.
Okay, now let's go. So I'm going to start to your head up until your toe. Okay? Now let's start with your hair. Okay, I don't see any bald spots. Hair texture is good. Scalp is fully intact with the hair. Hair is thick. I don't see any lesions. Okay, all in all, in good condition. Now let's move on to your face. Okay. Okay, starting off, I already see that you have 2 moles under your jaw. It is flat. Let me measure it. Okay. So both of these moles are under 0.2 centimeters. The borders are regular and it is symmetrical. Your eyelash and eyebrows look thick. Okay, I don't see any discoloration. In your earlobes, I notice that you have 2 holes, one on each side. And that's all. Okay, now let's move on to your neck. Oops, I'm sorry. On your neck. Okay, I see here that the rash. Okay, so it really did obtain wounds. How hard did you scratch it?
Very hard.
Okay. Can you rate the pain and itchiness? From 1 to 10?
10.
Okay. So I can already see that it is very red. Okay. The wounds are dry. Okay. So now let's move on to the back of your. May I please ask if you can lift your shirt? Okay, thank you. Okay, let me cover you up so you feel comfortable. Okay. So there are no discoloration from the back. The rash didn't go through. Okay. The back is clear. No lesions. No signs of rash. Okay. And no discoloration. Okay. You can now back your shirt. Thank you so much, sir. Okay. Ask if you can lift your arm. Okay. You have a warm temperature. No no lesions, no discoloration. That's good. Arm is moisturized. Now let me see your fingernails. Okay, fingernails looks clean. No signs of clubbing and capillary refill is excellent. Okay, now let me see your other arm. Again, temperature is warm. There's no lesions, no signs of abnormalities. Capillary refill looks good. No signs of clubbing and fingernails looks clean. That's a good sign. Okay. Now may I ask if you can lie down? Now I'm going to check your lower extremities. Okay. So can you please lift up? No, can you please lift up your short? So just a little bit, sir. Okay. Now I'm going to check. Okay, I don't see anything that we should be worried about. All looks clean. Okay, that's a good sign. No discoloration again under your lower extremities. Now let's move on to your legs. Okay. I do see here you have one scar. May I ask how this happened?
I crashed on my bicycle
Okay, so when did you crash on your bicycle?
5 years ago.
Okay, 5 years ago. So after you got this scar, nothing happened around your body, nothing abnormal happened.
No.
Okay, it's a good sign. Okay, legs clear. Let's check the other side. Okay, clear. Now let's check your feet. Okay, I don't see discoloration, no rashes. Okay, everything looks good. Let's check the other side. Oh, I also see that you have another scar. How this happened?
Oh, that was I was bitten by a dog.
Okay, did you had an anti-rabies?
Yeah.
Okay. Okay. So besides the scar, I don't see anything that we should be worried about. You may now go sit down. Let me help you, sir. Okay. So upon assessing you, I already the summarization of what I've discovered is that let me just get okay. So to summarize it all, you have no color discoloration around your body, which is a good sign. The only problem I see is that the neck area, the rash developed wounds, which is a very bad sign since that can contaminate your skin. You have two pierces on your ears, one on each side. You have two moles under your jaw. It is a flat mole, regular borders, and it is symmetrical. I also see that in your leg you have one scar from 5 years ago when you rode a bicycle, and one on your foot when you were bitten by a dog. Is that all right? Is
Yes.
that right? So again, there's no lesions. I don't see any lesions, no bumps. No, capillary refill on fingernails is good. No clubbing, which is a good sign. Okay. So now I'm going to go to call the doctor to check up on you. I'll be right back.
Thank you.
Okay, I'm back. Is the doctor done checking your rash and wounds?
Yes.
Okay, so I'm going to cover it. Okay. So here is the doctor's medical prescription. Now I'm going to give you my health teachings. First of all, please don't touch the wounded area and the rash with your dirty hands. So first of all, always clean your hands and your body, of course. Okay. Okay. After that, you have to always check if the wound is getting worse or if there is anything like happening. If it is swelling, go to the hospital immediately. Okay. So I advise if you don't touch it, you don't scratch it, just don't do anything with it. Okay. You just have to clean it with your of course clean hands. Okay. Okay. That is all. Thank you so much, Mr. Zeke.
After doing the skin assessment, we must again perform proper hand washing to clean our hands and be safe from any bacteria or contamination.